The second case is a little bit more of the chronic style, and I think this is really one of the most challenging substrative patient that we get. A 69-year-old Hispanic male came with quote-unquote acute leg swelling. He was actually treated with Eliquis because he came on Thanksgiving night, and he was sent home. Then he comes back in, and we repeat the ultrasound, which is still showing an occlusive thrombus in the pub and the femoral vein. And this is, for people who does this routinely, the moment you take this picture, you clearly see some chronicity. This is all collateral. It's just a still frame to show you the basket at the common femoral and pulling it back, but his clot that came out was extremely chronic. The final result, let's see if this is playing. Yeah, sorry, this is not a subtracted picture, but the final result looks really good. I'm sorry, here, let's go back. And we wanted to see, with IVUS, there was significant compression, but we wanted to test it with the balloon. This is something, there's no guidelines for it, but to me, when the IVUS doesn't show clear compression, it would show me, 50, 60%. I like to balloon it to see if I see some of the dog boning, and in this way, you can see it really, it was significant dog boning, which really reflects some scar tissue buildup in that location. Again, we put one Aubrey stent, and this is the final result. A nice expansion. So this is just case to highlight, the possibility to utilizing it in more of a chronic clot than just the acute clot.
With this device, traditionally with mechanical venous thrombectomy, we oftentimes will get pain in that compression spot or in that common femoral spot, or we kind of have a fixed device so we can overstretch the vein. Do you think being able to size to the area that you're treating is of benefit?
Oh, definitely. I mean, especially with the chronic cases, sometimes when you pull back and you see the back is, start closing, you can tell you have some resistance. You can easily close the back, pull it back, and deploy it again just below that. So there's a significant improvement there. So you're not having to kind of really try to aggressively pull and yank on that. So I don't know if that's the medical terminology, but to try to pull that chronic clot, and that's where the patient have a lot of pain. So there's a lot of unique dynamic for this device that's very helpful.